gauze dressings from the first aid kit and put direct pressure on the dressings over the bleeding area using the flat part of your fingers or the palm of your hand. If the bleeding doesn't slow or stop, add more dressings and press harder. Do not remove any gauze once it's in place. Keep pressure on the wound until it stops bleeding. If you can't keep pressure on the wound, wrap a bandage firmly over the dressings to hold them in place. Once the bleeding has stopped, if you haven't already done so, wrap a bandage firmly over the dressings to hold them in place. Now, we'll show you a demonstration of what the steps for stopping bleeding you can see look like. You'll practice what you learn afterwards, so pay close attention. First, make sure the scene is safe for you and the injured person.
Okay, the scene is safe. You, call 911 and get the first aid kit. Take this and apply pressure over the cut. I'm wearing gloves.
Use pressure and gauze to stop the bleeding. If bleeding does not stop, apply more gauze dressings and more pressure. Do not remove any gauze once it's in place.
The bleeding has not stopped.
You should be able to stop most bleeding with pressure over plenty of gauze. Call for help if there's a lot of bleeding, if you can't stop the bleeding, or if you're not sure what to do. Using pressure with a dressing helps you stop bleeding, but to protect the injured body part, you should use a bandage. Let's talk now about the difference between a dressing and a bandage so you can understand how they work together. A dressing is a clean material used directly on a wound to stop bleeding. It can be a piece of gauze or any other clean piece of cloth. A bandage is material used to protect or cover an injured body part. A bandage may also be used to help keep pressure on a wound. If necessary, you can hold gauze dressings in place over a wound with a small bandage. The bandage can be applied with enough pressure to help stop the bleeding, but it's best if a dressing is placed on the actual wound first. After you've used direct pressure and dressings, if available, to stop bleeding, apply the bandage over the dressings to keep pressure on the injury. The video will now pause for you to practice stopping bleeding using gauze dressings and bandages. Pair up with a partner and take turns being the injured person and rescuer. Your instructor will test your skills after you get a chance to practice. If an arm or a leg has severe bleeding, that is, blood keeps flowing no matter how much direct pressure you apply or for how long, you can try to use a tourniquet to stop the bleeding. The best tourniquets are pre-made or manufactured ones. They include a strap that you wrap around the injured person's body part and a straight stick-like object called a windlass, which you will use to tighten the tourniquet to stop the bleeding. However, you can make a tourniquet out of a piece of cloth and any sturdy object that is similar to a windlass, such as a small hand tool if necessary. To use a handmade tourniquet, first make sure the scene is safe. And wear personal protective equipment. Fold the cloth or bandage so that it's long and at least 1 inch wide. Wrap the bandage 2 inches above the injury if possible. Tie the ends of the bandage around a stick or something similar. Turn the stick to tighten the tourniquet. Continue tightening until the bleeding stops. Secure the stick so the tourniquet stays tight. Note what time the tourniquet was placed and get medical help as soon as possible.
Ow! Ow, man! Ow! Oh! Oh, man.
Dave, grab your cell and call 911. Hey, Tommy, cut that saw off for me. Be careful. Keep that area clear back there, too.
Boss, I'm sorry. The chain broke. It snapped right back. Oh, yeah. It cut me pretty badly. Right below the elbow. Oh, kind of weak.
Let's get that bleeding under control. Here you go. All right, listen. We need you to put that gauze in your arm and put pressure on the cut, okay?
Hey, we're out on the edge of town, sir. Dispatcher says it's gonna take a little bit.
I don't think this is helping, boss. It's still bleeding pretty badly.
All right. We need you to get some more gauze on that arm, okay?
Okay.
Yeah, press down on that. There you go. You're doing good. Listen, buddy. Help's on the way, but in the meantime, I'm gonna put this tourniquet on your arm. Get that bleeding stopped, okay?
I'm feeling kind of cold.
Now you're just going into shock. You get that bleeding stopped.
Ow! Oh, boss, that hurts.
I know, buddy. Sorry. But looks like it's working. Hey, what time is it?
2:15.
Can you grab that blanket out of the first aid kit for me? Thanks.
Take the following actions when using a tourniquet. First, make sure the scene is safe for you and the injured person. Call your emergency response number or 911 and get the first aid kit and AED. Use personal protective equipment. Place the tourniquet about 2 inches above the injury if possible. Tighten the tourniquet until the bleeding stops. Note what time the tourniquet was placed on the body. Once you have the tourniquet in place, leave it alone until someone with more advanced training arrives and takes over. As a rescuer, you may be asked to help someone who has a nosebleed. There are some things you can do to help stop this bleeding.
Jess, they called and said you were having trouble. Can I help?
Yeah, thanks.
What happened?
I need help. I don't know what happened. My nose just started bleeding.
Okay, well, sit down for me. No, lean your head forward. You don't want to lean your head back when you're trying to stop a nosebleed.
Okay.
All right. Now, I'm going to have to pinch your nose pretty hard with this gauze for several minutes, okay?
Okay.
A nosebleed is bleeding you can see, so the first aid action is to stop the bleeding with pressure. First, make sure the scene is safe. Get the first aid kit and put on protective equipment. Press both sides of the nostrils while the person sits and leans forward. Place constant pressure on both sides of the nostrils for a few minutes until the bleeding stops. If bleeding continues, press harder. Call your emergency response number or 911. If bleeding does not stop in about 15 minutes, the bleeding is heavy, such as gushing blood, or if the injured person has trouble breathing, check for signs of shock. Like other bleeding you can see, bleeding from the mouth can usually be stopped with pressure. A mouth injury can be serious if blood or broken teeth block the airway and cause breathing problems. When giving first aid to a person who is bleeding from the mouth, first make sure the scene is safe.
Okay, sit right there for me.
If bleeding is coming from the tongue, lip, or cheek, and you can reach it easily, press with gauze or a clean cloth.
Here, put this where it's bleeding. Press down on it.
Call or ask someone else to call your emergency response number or 911 if you can't stop the bleeding or the person has trouble breathing. Sometimes when a person suffers a mouth injury, one or more teeth may become broken, loose, or knocked out. This can be a choking hazard. First, make sure the scene is safe for you and the injured person. Send someone to get the first aid kit. Put on personal protective equipment. Check the person's mouth for any loose or missing teeth or parts of teeth. Clean the area where the tooth was located with clean water. If a tooth is loose, have the person bite down on a piece of gauze to keep the tooth in place and call a dentist. Apply pressure with gauze to stop any bleeding at the empty tooth socket. If a tooth has come out, put the tooth in a cup of milk or clean water and suggest to the injured person immediately take the tooth and visit a dentist or emergency department. Tell the person to talk to a dentist if a tooth changes color after an injury. If a tooth is merely chipped, gently clean the injured area and call a dentist. It may be possible for a dentist to reattach a loose tooth, so when handling one, hold it by the crown, not by the root, the part that was in the person's gum. Make sure you keep the tooth out of the person's mouth. A person's eye can become irritated from a scratch or a small or large object in the eye. Usually, it's just a small piece of dirt or flying particles. The following are typical signs of eye injuries: pain in the eye, trouble seeing, bruising, bleeding, redness or swelling. Follow these steps for eye injuries. First, make sure the scene is safe. Get the first aid kit and put on personal protective equipment. Call your emergency response number or 911 if the eye is hit hard or punctured. Tell the person to keep both eyes closed. If there is an irritant in the eye, such as sand, use lots of running water to rinse the eye. If the object does not come out with rinsing, or if the person complains about extreme pain, call or ask someone to call your emergency response number or 911. Tell the person to keep her eyes closed until someone with more advanced training takes over. Puncture wounds occur when a person is injured by a sharp object like a stick or knife. If the object is stuck in the body, leave it there. Taking it out may cause more damage. Follow these steps for penetrating and puncturing injuries. First, make sure the scene is safe. Get the first aid kit and put on personal protective equipment. Call or ask someone to call your emergency response number or 911. Try to stop any bleeding you can see. Try to keep the injured person from moving. Amputation occurs when any part of an arm or leg is cut off. Amputated body parts, such as a finger or toe, may be able to be reattached. You can preserve a detached body part at room temperature, but it will be in better condition to be reattached if you keep it cool. Stop bleeding from the injured area with pressure. You may have to press for a long time with very firm pressure. Look for signs of shock. If you are giving first aid to a person with an amputation, first, make sure the scene is safe. Get the first aid kit and put on personal protective equipment. Call or ask someone to call your emergency response number or 911. Try to stop any bleeding from the injured area with pressure. You may have to press for a long time with very firm pressure to stop the bleeding. If you find the amputated part, protect it. Stay with the injured person until someone with more advanced training arrives and takes over. To protect the amputated part, rinse it in clean water. Then cover it with a clean dressing. And place it in a watertight plastic bag if it will fit. Place the bag in another container with ice or ice and water. and label it with the injured person's name, the date, and time. Make sure it gets to the hospital with the injured person. Remember, do not place the amputated body part directly on ice because extreme cold can injure it.
So, where are we going for lunch?
Depends on what you're in the mood for. There's a lot of really good restaurants around here.
Bye.
Hey, Matt.
Hey.
Okay, so how did you want to deal with the convention? What time are they getting here?
Well, the check-in is at 2, so do we have all of those rooms ready?
Yeah, the maids are working on that right now, and you mentioned something about flowers.
Matt, what happened?
Oh, that ladder slipped out from under me. Then I hit my side on that cabinet on the way down.
Well, listen, I know first aid. Can I help you?
Yeah, please.
Okay. Listen, go use the house phone by the elevator, hit 9 to get an outside line, then dial 911, all right?
Sure, you got it. Is he all right?
Oh, my side's hurting really bad.
Yeah, you really got it right there.
Oh, I'm feeling dizzy.
Now, Matt, listen to me. You could have bleeding on the inside. Are you hurting anywhere else?
No, it's just my side.
Okay, well, listen, I want you just to lay there and be calm and lie still for me, okay? We've already called for help.
Yeah, okay. Thanks, Sam.
Let's talk about another kind of bleeding, bleeding you can't see. A strong blow to the chest or abdomen or a fall can cause injury and bleeding inside the body. You may not see signs of bleeding on the outside of the body or at all, or you may see a bruise on the skin over the injury. An injury that has caused bleeding you can't see could be minor or very severe. You should suspect bleeding inside the body if a person is injured by a car crash or being hit by a car, a fall from a height, an injury to the abdomen or chest, pain in the chest or belly after an injury, shortness of breath after an injury, coughed up or vomited blood after an injury, sports injuries such as slamming into other people or being hit by an object, signs of shock without bleeding you can see, or a knife or gunshot wound. This could cause bleeding inside the body that you can't see. If you suspect bleeding you can't see, you should first make sure the scene is safe. Get the first aid kit and AED, and put on personal protective equipment. Call your emergency response number or 911. Have the person lie down and keep still. And check for signs of shock. Be prepared to check if the person needs CPR and give it if you know how. Now let's talk about how to recognize and provide first aid for head, neck, and spine injuries. Head injuries can happen if a person is struck hard on the head or falls from a height. Suspect a head injury if the injured person fell from a height, was injured by a strong blow to the head, was injured while diving, suffered an electrical injury, was in a car crash, was riding a bicycle or motorbike that was in a crash, especially when not wearing a helmet. Also suspect a head injury if an injured person does not respond or only moans or moves, is sleepy or confused, vomits, complains of a headache, has trouble seeing, has trouble walking or moving any part of the body, or has a seizure. The bones of the spine protect the spinal cord. Spinal cord carries messages between the brain and the body. If the spine is damaged, the spinal cord may be injured, and the person may have trouble moving her arms or legs, and may lose feeling in part of the body. Only twist or turn the head or neck if it's necessary to provide CPR, if you need to move the person out of danger, or if the person is having trouble breathing, is vomiting, or has fluids in her mouth. Suspect the spine bones might be damaged if an injured person is 65 years of age or older, was in a car or bicycle crash, has fallen from a height above the ground, has tingling or is weak in the extremities, has pain or tenderness in the neck or back, appears intoxicated or not fully alert, or has other painful injuries, especially of the head or neck. Follow these steps when giving first aid for a possible head or spine injury. First, make sure the scene is safe. Call your emergency response number, or 911, and get an AED and first aid kit. Minimize movement of the head and neck. Move the person only if she is in danger or if you need to provide CPR. If the person is having trouble breathing and is vomiting or has fluids in her mouth, roll her to the side. Injuries to bones, joints, and muscles are common in an active society. These injuries may include joint injuries, broken bones, and bruises.
Hey, Sean.
Hey, how you doing, Dean? You still coming on the hiking trip with us?
Yeah, got new hiking shoes. I'm ready to go. I'm excited. Listen, I'm late for a meeting, so I'll talk to you later, all right?
Sounds good.
Ow. Ow, that hurts.
Oh man, I'm so sorry. I have some first aid training. Can I help?
Yes, of course.
Where does it hurt?
My ankle.
Your ankle, okay. I need you to get rid of that dolly. I need you to get me a first aid kit, a bag of ice with water inside of it, and a towel.
Okay. Do you want a chemical cold pack instead?
No. The thing is, it doesn't get cold enough. Water and ice are much better.
Man,
the break room's right down the hall.
Man, this really hurts.
Oh, man, I'm sorry.
I didn't even see the dolly.
The thing is, once we get the bag on there with the ice and the water, it's going to help with the pain. It's going to help with the swelling as well.
Okay.
All right, perfect. Thanks. We'll put this on here. Now we're going to set this on here for 20 minutes, and then we're going to take it off.
Okay.
All right, and make sure that after we take it off, don't walk on it until you get some medical attention, okay?
Hey, thanks, Sean. It's a good thing you were here. So much for the hiking.
When giving first aid for a person with a possible broken bone or sprain, first, make sure the scene is safe. Get the first aid kit and put on personal protective equipment. Cover any open wound with a clean dressing. Put a plastic bag filled with ice and water on the injured area with a towel between the ice bag and the skin for up to 20 minutes. Call or ask someone to call your emergency response number, or 911, if there is a large open wound, the injured part is abnormally bent, or you're not sure what to do. If it hurts, the person should avoid using an injured body part until checked by a healthcare provider. When someone has a suspected broken bone or sprain, or if a broken bone has come through the skin, you should protect the injury until someone with more advanced training can take over. Don't straighten any part that's bent or deformed, and don't move a broken bone that has come through the skin. Instead, cover the wound with a clean dressing and splint as needed. One way to try to keep an injured body part from moving is to apply a splint. This is generally left up to trained medical providers. However, you might have to apply a splint yourself if you are far from someone with more advanced training. First, make sure the scene is safe for you and the injured person. Find an object that you can use to keep the injured arm or leg from moving. Any rigid, straight object, such as a magazine, a stick, or piece of wood will do. The splint should be longer than the injured area and should support the joints above and below the injury. Apply the splint to the arm or leg securely above and below the injury without trying to straighten it or move it. After covering any broken skin with a clean or sterile cloth, tie or tape the splint to the injured limb. It should fit snugly but not cut off circulation. If you're using a hard splint like wood, make sure you pad it with something soft like clothing or a towel. Keep the limb still until the injured person can be seen by a healthcare provider. It will take an X-ray to know for sure if a bone is broken. Your instructor will now pause the video so you can practice splinting. Team up with a partner and your instructor will guide you. Burns are injuries that can be caused by contact with heat, electricity, or chemicals. Burns caused by heat can be a result of contact with fire, a hot surface, a hot liquid, or steam. Use cool water on burns. Ice can actually damage a burned area. It's best to keep a person with a burn from getting too cold.
Oh! Larry, you okay?
I got coffee on my arm. It hurts.
Hey man, let's get your arm underneath the water.
Follow these steps if the burn area is small. Make sure the scene is safe. Get the first aid kit and use personal protective equipment. Cool the burn area immediately with cold but not ice-cold water. Run cold water on the burn until it doesn't hurt. You may cover the burn with a dry, non-sticking, sterile, or clean dressing. Call for help if there's a fire, if the burn area is large, or if you're not sure what to do. Many people have heard about different ointments for burns. The only thing you should put on a burn is cool water and clean dressings. That's it, unless you're given other instructions by a healthcare provider. Remember, if there is a large burn or fire, call for help.
Shirt's burnt. We're gonna have to get it off. Let's get it off.
First aid actions for burns caused by fire are to make sure the scene is safe and get the first aid kit. If you have any questions about safety, call for help. To give first aid to a person with a large burn, first, make sure the scene is safe. Get the first aid kit and